Exercise for your brain. And I think that's the most important anybody should consider exercising, is for the health of your brain and the function for your brain. And we're going to expand on that here. This is another one of my recent shows. We're talking about 6 pillars to your health and wellness. 6 pillars. Number 1 is nutrition. We've done that. Number 2, exercise. 3, sleep. 4 is spine. 5, of course, is the one that we really need to spend time on, which is stress. And then 6, we're going to add in there supplements. And I'm going to be adding in supplements down the road with another show. And you'll see this on YouTube. So stay tuned. If you miss anything here on cable, go to the YouTube page. Introducing this article again, here we are in 2020. Harvard came out early in 2020 with a study that says you can increase 10 years of health span, not just 10 years of life, but 10 years of disease-free life by doing 5 things. Number 1 is clean eating. Number 2 is maintain your weight. Number 3 is exercise 30 minutes per day. More on the exercise thing, that's what we're going to focus on here. Exercising 30 minutes per day. And the other 2, we're just avoiding a couple bad things I think everybody knows, is don't smoke and reduce your alcohol intake, okay? So the first 3 you can limit down to 2. So how do you maintain your weight? You do that with clean eating and regular exercise, among some other things. So you can kind of eliminate that, and you're kind of down to 2 things now, assuming you already know the bad things, is clean eating and regular exercise 30 minutes a day. And that's pretty cool. And again, we're going to be doing this for our brain. Important books. If you haven't caught my show recently, I've talked about these 3 books. I think you really need to take a look at them. They're just super important. The Hacking of the American Mind by Dr. Robert Lustig. It talks about how our minds have been taken over and conditioned by foods that we've been conditioned to eat, by media, by phones, by electronic screens, and so forth, with steps on how to change that. He did a great job on that. The second book is Own Yourself with Dr. Kelly Brogan. I don't have the book here, but you'll see that online. It's a great book to read. She is now a holistic psychiatrist. She has a specialty in getting people off of psychiatric medications, and I'm not recommending doing that. You need to check with your doctor before doing those kind of things. But she also, on her website, Dr. Kelly Brogan, MD, she has a great online program that you can follow as well to help augment and reducing the chances of having depression and anxiety and so forth. So dig into that. The End of Alzheimer's by Dr. Dale Bredesen, great book, The End of Alzheimer's. And he talks about, and we're going to touch on this book in a moment, and he talks about taking people with diagnosed Alzheimer's dementia and seeing them actually get better. Seeing them get better. And you best believe exercise is one of the several things that he recommends in his program. Do what Jack LaLanne did. And if you don't know who Jack LaLanne is, take a couple minutes and introduce yourself to him. Jack LaLanne passed away in 2011, but he was 96 years old. He had no chronic disease, no over-the-counter medications, no pharmaceutical medications. He exercised and ate great every day for his life until the week that he died. He caught pneumonia and died in a week, basically died of old age. But he exercised every day. And there was even a film crew that followed him around at his home when he was in his 90s. And he was pumping iron every day and swimming at his home pool every day. So he's exercising and eating super clean nutrition. If you followed him, he was a super clean eater. He had statements such as, if man made it, don't eat it. If it tastes good, spit it out. These are called LaLanneisms, really good stuff. And exercise is king, nutrition is queen, together you have a kingdom. And he was right, talking about these things 50, 60 years ago. Okay. So Jack LaLanne, by the way, Jack LaLanne was a chiropractor. Jack LaLanne was a chiropractor. He got his chiropractic degree. Now, he never practiced chiropractic that I know of because his fitness career took off, but he knew the importance of spine and alignment and keeping the nervous system and brain working. And so even in his 90s, if you saw commercials with him on Juice Man, you'd see that his posture and spine was still well taken care of. Again, more information, more motivation for us, more energy for us to do the nutrition thing and the exercise thing and the spine and the nervous system thing, reducing stress. He had a great attitude toward life and everything that he did, great attitude. There's the stress component. I'm not sure about sleep. look into that sometime. Why exercise and why should we do it? I was alluding to that in the beginning. It is all about your brain. Everything that we enjoy in life is our brain and the neurotransmitters in our brain. So you can improve the neurotransmitters that you want in your brain with exercise. You'll have that satisfaction that I'm in control of my life. You can say, I'm taking this step. I can take this step nutritionally to make my body as good as can be. I can exercise on a regular basis, so I'm going to carve that in because this is important for me. Sure, I need to deliver other things for other people, whether I'm a parent, I'm taking care of my parents or grandparents, or I want to be the best for my children, or I'm a teacher, or whatever the work that I'm doing. I want to be a good coworker in my workplace. Maybe I own a business, whatever it might be, whatever service you might be delivering, I'm going to focus on protection of wildlife and the planet and forests and move toward a more sustainable earth. Whatever that is, you're going to do it better with a healthier body. And that's the reason that you want to do exercise. Keep in mind the brain is like a muscle, and this has been something I've talked about for a couple of decades now. The brain is like a muscle. You can mold and shape and change your brain, just like Dr. Dale Bredesen is saying with Alzheimer's dementia. So if you haven't exercised your entire life, if you haven't exercised in 30 years, it doesn't matter. There are just stories and motivation and examples of people that have been not exercising for a while and just have completely transformed themselves. Again, there's TV shows on this kind of thing, right? So you can wrap your head around people that have made changes in their life. It's never too early to start, and it certainly is never too late. You'll see these words here, neuroplasticity and neurogenesis. Neuroplasticity means that we can mold and change and improve our brain no matter what the age. And if you think of it like this, let's say we're 90 years old and we never learned a foreign language and we want to learn French. Can we learn French? We certainly can. Now, it might take us a little bit longer. It might be a little more difficult when we're 90 than when we were 0 or 20, but you can still do it because the brain is constantly changing. You can learn new skills and new things all the time. Neurogenesis, and this is another hot topic in research right now, that we used to think, and I used to think also, that basically you're born with all the brain cells that you're going to get, and that's it. Now some are saying, not so much. The central nervous system might actually have neurogenesis, where you can actually grow new neurons, and that's pretty good. How can you do that? Well, when you exercise, when you stimulate all of the nerve endings in your joints and muscles and tendons of your body, it's sending electrical impulses through all the nerves from the body into the brain. Do you follow? So most of us think that the brain sends output to the body and it controls the body. And that's true, but that's exactly half of what's going on in the body. The other half is information from the body back into the brain. So when we sit all day like this, if you've been sitting like this for 8 hours, pounding away, usually at home now, unfortunately with Corona jail, you're sitting at home pounding away like this. How do you feel at the end of the day after you've been sitting like this for 8 hours, right? Really sharp and ready to go? No, of course not, because you've just done this. You haven't moved your body very much. But if you go for a vigorous walk, or you do a workout, or you resistance train, or whatever you might be doing, how does your brain work at that time? You're definitely sharper. You're definitely more on point. You're definitely taking better care of yourself. You have more focus and concentration and so forth. So that's the neurogenesis, and that's the reason that you exercise. 50% of what's going on in your body is the information from the body back to the brain. So if we want better neuroplasticity in a good way, if we want better the chance of neurogenesis, we have to send electrical impulses and make that brain shine like a light bulb. That's the reason you're doing these things. If you're watching this and you see the slide, you're going to see obesity consequences just listed on the CDC's website. And it's a huge list, but the reason I wanted to bring this to your attention is now during this COVID thing, that obesity is one of the main chronic disease complications that will potentially lead to more severe disease. Now that's the same with seasonal flu prior to COVID-19. Seasonal flu, these have been listed as problems, that people that are going to have more severe disease, such as heart disease and cancer and diabetes and so forth. Obesity is one of them in here. So getting ourselves exercising and back to normal weight, we can fight off all viruses, including coronaviruses, including COVID-19 coronavirus. So we want our immune system to be stronger. That's another reason that you exercise. Who doesn't want a stronger immune system, particularly when we're introduced to a new viral strain, such as a new seasonal flu strain or COVID-19, whatever it might be. So obesity is linked to all of these chronic diseases and disorders. Knocking that down somewhat with exercise is a great idea. There's many, many studies on exercise for depression and anxiety. Here's a couple here. This was a study out of Duke University 10 years ago, September 2000. Exercise has long-lasting effects on depression, and that's pretty cool. 30 minutes of brisk exercise just 3 times a week is just as effective as drug therapy. In this particular case, it was Zoloft, in relieving the symptoms of major depression in the short term. The important conclusion is that the effectiveness of exercise seems to persist over time. So not only is it at least as good, according to this study, as one of the most common drugs given for depression, but it has an effect that lasts over time. The patients who respond well to exercise and maintain their exercise have a much smaller risk of relapsing. That's pretty important information. Now that's somebody that's been diagnosed with depression. What about the rest of us that just might be in a sour mood? I mean, that's telling us that we can jazz up and improve our mood by just getting some regular exercise, and that's 30 minutes 3 times a week. Another one here out of the Journal of Clinical Psychiatry in 2011. It was a randomized control study. Exercise as an augmentation treatment for non-remitted major depressive disorder. Now this means that this was a group of people here that were given SSRIs, and the drugs were not working. They weren't working. So again, these are like, if you will, the tougher cases that weren't responding. And so they found that the exercise group had a much better chance of improvement. 30% of people in the exercise group had remission of their symptoms, and there was a trend for higher remission rates in the higher dose exercise group. The more exercise, the more results. Here's just a few other studies, just want to touch on them. Exercise improves sleep in major depressive disorders. Conclusion of this one, this was the Psychological Medicine Journal in 2012. Exercise augmentation resulted in improvements in self-reported sleep quality in patients with non-remitted major depressive disorder. So if you exercise, you sleep better. If you sleep better, your brain works better. If your brain works better, you're going to have less depression. It's all tied together there, right? This is an article out of The Atlantic in 2014. Here's the title of it: For Depression, Prescribing Exercise Before Medication. Aerobic activity is shown to be an effective treatment for many forms of depression, is the subheading. So why are so many people still on antidepressants? Depression is the most common mental illness, affecting a staggering 25% of Americans. But a growing body of research suggests that one of the best cures is cheap and available. In 1999, that study said that depressed adults did as well with exercise as Zoloft, as it says here. The 2011 study, it says, once again, that we had referenced, that people that didn't get better with drugs, 30% got better with exercise. Why aren't we doing this on a regular basis, right? Scandinavian Journal of Medicine and Science and Sports, 2012 article. Previous meta-analysis investigating effects of exercise on depression have included trials where the control has been categorized as placebo, despite the fact that this particular placebo has been recognized as having antidepressant effect. Meditation and relaxation was used, but it showed effects along with the exercise. So meditation and relaxation showed improvements in depression, so did exercise, is what the studies say. 13 studies that these folks reviewed presented sufficient evidence for calculating effect sizes. Large overall effect favoring exercise intervention for depression. On this website, heartzones.com, this is Sally Edwards, more on her in a moment. The connection between exercise and mental health. An active lifestyle can improve mood. Another article, Journal of Clinical Psychiatry, again, 2006, Exercise for Mental Health. Right at the end, here's some of the discussion. Health benefits from regular exercise that should be emphasized and reinforced by every mental health professional to their patients include the following. This is why we should prescribe it. Improved sleep, improved interest in sex, better endurance, sleep relief, improvements in mood, increased energy and stamina, reduced tiredness that can increase mental alertness, weight reduction, reduced cholesterol, and improved cardiovascular fitness. All of that with exercise. And this study, I love these words, It should be exercise should be emphasized and reinforced by every mental health professional. I think that's improvement. That's very impressive. Okay, exercise for depression. Here's just a couple of guidelines, of course, and I like some of these words from other researchers and other things that I've read. Consistency is, of course, key, like everything else, like eating better, like sleep, and so on and so forth. Not doing enough sessions is like a diabetic using insulin occasionally. Well, that wouldn't make sense, right? You need consistency there. Same thing with exercise if you want to get those results. Now, the insurance challenge is doctors need to take time to talk about this with their patients, like I am on this show right here now, taking time away from my office to spend with you, to have it there as a resource for anybody who's interested. But insurance, in a large portion, does not reimburse doctors to take the time to sit down and have their patients on an exercise scenario, or the doctor maybe could have somebody down the hall said, go see George and Sally down the hall, they're going to put you on a regular exercise program, you're going to work with them, and so on and so forth. But that might not be reimbursable, and so forth. Again, we're not getting reimbursed. There's not the money incentive, at least in the insurance, third-party pay, to get these things rolling, which we know would be effective. By the way, here's an easy measurement. To know where you are, you can use a scale if you want. And by the way, if you're weighing yourself, I recommend like once a month or less. There's just no reason to be weighing yourself. I've seen people really run into a problem if they're weighing themselves like 2 or 3 times a day or daily. You know, you're not going to lose 10 pounds in a day, and if you did, there's something else going on, right? So what you can do, you can also do what is called the waist to hip ratio. You can literally take a tape measure around your waist and a tape measure around your hips. Your belly should be smaller than your butt. Your belly should be smaller than your butt. And you do the ratio. It should be 0.9 or less for men, 0.85 or less for women. If it's 1.0 or larger, meaning your belly's bigger than your butt, then you're in trouble and you're at the risk of all kinds of things. And it could be a better predictor of where you are in your health and wellness scenario than BMI. Now remember that BMI doesn't work for people who are muscular, right? They might have a high BMI, but they're muscular and super fit and they're very healthy, so BMI doesn't always work. By the way, if you do this waist to hip ratio, just keep in mind it's not accurate in people that are shorter than 5 feet tall, and it's also not accurate in children. Not accurate in children. Okay, this book, before I get into toward the end, I'm going to give you a list of things and things to follow about exercise. This is a very interesting book here. It's a book called Spark by John Ratey. Spark. And in the introduction here, he has a couple of statements that are just so powerful. What I aim to do here is to deliver in plain English the inspiring science connecting exercise and the brain, and to demonstrate how it plays out in the lives of real people. I want to cement the idea that exercise has a profound effect on cognitive abilities and mental health. There's a summary right there, right? It is simply one of the best treatments we have for most psychiatric problems. Spark by John Ratey. I've recommended this to tons of people. This is one portion of him demonstrating how exercise helps kids with academics. In Naperville, Illinois, gym classes transformed the student body of 19,000 into perhaps the fittest in the nation. Among one entire class of sophomores, only 3% were overweight, versus the national average of 30%. Now this, what I'm going to talk about, is 20 years ago. What's more surprising is that the program also turned these students into some of the smartest in the nation. In 1999, 21 years ago, Naperville's 8th graders were among some 230,000 students from around the world who took an international standards test called the TIMSS, which evaluates knowledge of math and science. In recent years, students in China, Japan, and Singapore have outpaced American kids in these crucial subjects. But Naperville is a conspicuous exception. When its students took this test, they finished 6th in math and 1st in the world in science. So they were outliers, but they were outliers because they integrated a lot of fitness into their school program. And the book, the first part of the book talks about what they were doing exactly with the kids for workouts every single day. It didn't matter how fit or unfit the kids were, how little or how much they could do. They adapted the entire fitness thing every day for every kid. Just wonderful stuff. So how much exercise? That's a question that everybody asks. How much exercise? And by the way, always check with your doctor, particularly if you have a medical condition, if you have a known heart condition, if you haven't exercised in a while, if you haven't checked in with your doctor for a while, if you're on medications, any reason whatsoever, if you haven't been exercising, check with your doctor first, please. How much? Okay, here's my best recommendation. Here is my best recommendation. Do not exercise every day. Only exercise on the days that you eat. So if you have a day that you have not eaten, you can skip that day. That's how frequently you should exercise. Don't exercise every day. If it's been a while, 15 to 20 minutes can get the job done. Now that we're still involved here with Corona jail, for some people, because they're sitting all day long and they're sitting with their kids and you're doing the schoolwork with kids sometimes and then you're doing the thing at work at home. Plus, if you're working at home, you're probably finding that the natural breaks in an office environment are not there, going to the printer, going to the bathroom, meeting over here and so forth. You might actually want to split up your exercise into segments. So instead of exercising 30 minutes at lunch, which is great, maybe exercise 10 minutes 3 times in a day, completely as effective, if not more effective than exercising 30 minutes all at once. Maybe you exercise 10 minutes, a third of the way through the day, another 10 minutes, and then more of an exercise program at the end of the day. And that's fine too, okay? Mix it up, obviously, cardio and resistance training if you have the ability, if you know what you're doing. Please don't hurt yourself. Take care of your spine. More on that later. Okay. TV or exercise, I just came across this. So how much TV are we all watching right now? Yeah, the answer is too much. This is out of The Atlantic on 2018. Americans still watch an astounding amount of TV. In fact, television viewing didn't peak until 10 years ago, 2010, when the average American household watched 8 hours and 55 minutes of TV per day. And in the 2000s, from 2000 to 2010, saw the greatest growth in TV viewing time ever since Nielsen has been keeping the ratings since 1950. 1950, it was 1 hour and 23 minutes of more television after a decade. And when you run the numbers, it's actually increased 32% from 2000 to 2010. So we're watching a lot of TV. Over the last 8 years, from 2010 to 2018, all of the new non-TV things, Facebook, phones, YouTube, Netflix, has only cut about a half hour per day from the dizzying amount of TV that the average household watches. Americans are still watching more than 7 hours and 50 minutes of TV per day. So a lot of people, if you fall into the category, you have the time. You have the time. You have the time. Okay. One thing before I get into my list, heart rate monitoring. So there's so many wearables and devices now, right, that talk about heart rate. This is an important point. Look into this a little bit. This is an important point. This is off the website. You can go here for all the help that you need. Heartzones.com. This is Sally Edwards. I know Sally Edwards. She's been doing a tremendous job of trying to get America fit. Get America fit. That has been her lifelong passion for decades. Sally Edwards has written 24 books. She is no slouch. She works really hard at this. She was the one that taught me close to 20 years ago now that your heart rate does not, your maximum heart rate does not decline with age. So all of the charts that you see everywhere that has 220 minus your age, which is your maximum heart rate, is simply not true. Go dig up the original research. It is not accurate. Your maximum heart rate for the most part is genetically set, and it will stay that way for the rest of your life. Some people have a lower maximum heart rate, some have a higher one. Now, sure, the more unfit you are, and the older you are, and also unfit, the less chance you have of getting to your maximum heart rate, okay? And that's why so many people are told, be careful and so on and so forth. And again, you should work with your doctor on this, but I'm just letting you know, 220 minus your age is not it. You need to go calculate your own maximum heart rate if you want to determine what heart zones that you're going to be working out in. Okay, so just keep that in mind. Very, very important. Plenty of information on heartzones.com. Water, so if you're starting to exercise and you're drinking X amount of water and you're increasing your volume of exercise, you're going to need a little more water. If you missed my show on that, you can go to my YouTube page, Water Rules, watch that Water Rules, check with your doctor if you're taking any medications, kidney issues, whatever, before you start drowning yourself with more water, okay? And you can drink too much. You can drink too much. Okay, exercise success. As the end here, here's a list of things that you can follow that can help you. Again, always check with your doctor first before you start an exercise program. Number one, just keep in mind the main reason I think anybody should consider exercise is for the health of your brain, so you can enjoy your life and be the best version of yourself. Number two, a workout buddy will help. The two of you, or three of you, or the group of you, whatever it is, can put pressure on each other to follow through on an exercise program. If you need to get a trainer, get a trainer. Get a trainer because there's that accountability thing. Buddies, trainers, the whole thing, whatever it takes. So now that you're working at home with Corona Jail, it's even more important to make sure you're carving out your time that you can exercise. You might actually need a little more exercise, like I talked about earlier. You might find that you're sitting more now. The natural breaks in an office environment not there. You're sitting at bad workstations, take care of your spine, and so forth. What has helped a lot of people, and I've actually done webinars for lots of companies and groups over the past 10 months here in 2020. So they've been consulting with me on a variety of things. One of them has been exercise. And one of the things I say is put in exercise in your schedule just like it's a meeting. Just like it's a meeting. You know all those Zoom meetings that are just driving you bonkers? Time to put in another meeting, but this time it's going to be your exercise meeting. It's going to be your workout. Maybe you're going to do an exercise video that you're familiar with. Maybe you're working with your trainer virtually. You just get outside and do your stuff. Okay, so put it in your schedule if you need to. I always recommend warming up your spine. Take care of your spine and your nervous system just like Jack LaLanne has taught us in the past. If you need help there, go to my website, go to my video page, stretch your spine, take care of your spine, sitting ergonomics, sitting management. I have lots of videos and I've done shows here on that as well. Take care of your spine. 2 to 3 times a day, as we talked about. Sometimes we need to break that up and have exercise sessions instead of one exercise session for 30 minutes. Maybe it's 3 10-minute exercise sessions. It's just as good. Try to find activities that you like. I've got some people that are dancing now. Some people are getting the hula hoop back out. Some people doing belly dancing. I mean, lots of things are really popular now. Find things that you like. Rotate them around if you need to. Walking is a good start, but I don't think it's enough. I think most of us, if you have the ability, need resistance training. There it is, cardio and resistance training. Do some cardio, but try to get some resistance training. And if you're not familiar, get help, get a trainer, work with your physical therapist, knowledgeable chiropractor, whatever you need to. HIIT, high intensity interval training. When you're ready for that and you have clearance with your doctor, you can look into those. Don't exercise too close to bedtime. For a lot of people, that will just wake you up and disturb sleep, so just be aware of that. If you do have muscle cramps and restless leg issues, could be dehydration, it very well could be magnesium deficiency. So go check out my video on YouTube on magnesium. Got a couple of videos on there, and also check with your doctor before you take magnesium supplements. And lastly, keep an exercise journal. If you're having a calendar that you're working on online, put it on there, check it off. Put it on there, check it off. As Simon Sinek says, you get a little dopamine hit every time you check off something in your list. And if it's something as beautiful as exercise and you check that off, if it's something as beautiful as meditation and mindfulness, you check that off. If something as great as you're stretching your spine, you're doing Dr. Fuller's stretches, you check that off, you get a little hit of dopamine, and that's a good thing. You check it off when you're increasing more vegetables. Keep that exercise journal. I'm Dr. Scott Fuller. Thank you.